at 3 p.m. and see hundreds of you signing on to stay connected as we navigate COVID-19 in community. So thank you very much. I'd also like to recognize Dr. Nikki Damania, who is facilitating this forum, and Shannon Musser and Leslie Bonds helping. So it's a great team that brings this to you every week. Moving to the next slide, my usual Johns Hopkins dashboard. And I think this was updated, very recently. As you can see, at 12:30 today, we have over 1 million confirmed cases worldwide. Moving to the next slide. Here are the numbers that I report to you every time we sign in, with one person who passed away in Kern County. Moving to the next slide. You will see that in Kern County, we have many tests that are still pending, and you have the breakdown in terms of the age group of people. Every day when you wake up and you listen to Dr. Anthony Fauci or you listen to Sanjay Gupta of CNN, we gain a little bit more knowledge in terms of this virus. You will see that between the age group of 18 and 49, we have 59 confirmed cases. So this is something that all of us should be concerned about. Moving to the next slide. I wanted to look at the face of Susie Garcia, the 52-year-old woman who passed away at Delano Regional Medical Center. Her son, Hector Garcia, graduated from Bakersfield College. Abel Guzman provided me this information. I know that the Delano Rural Initiative team is certainly feeling the passing away of this woman, part of their family, part of our renegade family. It's hitting close to home. I want to keep my spirits up, and because the information that you have from our panelists are going to be solutions to our problems. So I want to keep my spirits up, but I thought that this week I'll have much more of a stern and serious tone, because our behaviors are going to have serious implications to control the spread and therefore control the number of deaths from our community. This was a website that Leslie had discovered that really brings an index to social distancing. And what she found was that Kern County is not doing very well when it comes to understanding the concept of staying at home. Moving to the next slide. I had discovered this particular dashboard, I think, on Monday and started including it in both my Renegade Roundup as well as my virtual seminars. It's from the Institute for Health Metrics and Evaluation. And what Christopher Murray has for us here is really forecasting. And in this kind of a situation, forecasting what is to be expected in terms of the number of cases and the number of deaths is pretty significant. It's serious. So he gives us the option of looking at the modeling from a U.S. standpoint or from the state, and I've got a few pictures of California here. And these PowerPoints are also uploaded on our website, so you can go back and take a look at it. So you will see here that he is predicting that the United States will peak on April 15th. And he shows that we are going to be disadvantaged when it comes to having beds that are necessary for those who are really sick, particularly the ICU beds, as well as the ventilators. So this is why the staying at home, sheltering in place is absolutely critical, because when you see the curve of the epidemic, you can see that the modeling shows a shaded range showing that we have a certain amount of control whether we are at the flatter end of the shaded area or whether we are peaking at the upper end of the shaded area. So on this particular slide that Dylan created for me, he zoomed in to the April 15th and really spotlighted the shortage that we are going to be facing as a nation. And moving to the next slide, there is some modeling on deaths per day. So at this point, you're looking at, on April 15th, what is the estimated deaths per day by this model. Moving to the next slide and zooming into the April, it has April 16th here. You will see 2,644, but again, you see that range of 1,200 to 4,100. So again, my big message is do stay at home. And finally, the model ends with the total number of deaths predicted by this statistical modeling. Moving to the next slide. And okay, so now we're in California, and now I'm just kind of going to have you, Shannon, just click through it. In California, the good news is that our governor issued a stay-at-home really at the front end of it. So we're expecting California to be able to control the spread in a better way than New York could. And I'd like to point out to the fellow renegades that have joined in with us today that Bakersfield College, that we closed down our campuses and announced a complete physical campus shutdown 3 hours before Governor Newsom announced his stay-at-home. So we took those entire 3 weeks to really prepare to get our courses online, our student affairs online, and then to get other functions online. It is a difficult conversation. Bakersfield announced the closure of city playgrounds because, yes, we were getting out there to do our walks, but we were not really taking into account the social distancing part of staying at home. Moving to the next slide. My message has been augmented beyond stay at home, stay at home, stay at home to really try to have a healthy lifestyle to keep your immune system strong. That's my second ask of you. And I also ask you to role model for our entire community what that looks like: eating right, exercising, and sleeping. And if you must go out, cover your face. I know this has been a controversial topic in our country. And most recently, the CDC is starting to talk about the value in covering our faces, but not really going out there and purchasing medical masks. Those are for our nurses and our healthcare providers. I know this firsthand because my daughter is a surgeon, and she tells me that there is a protocol within the hospital where even surgeons have to reuse their masks because in the protocol, it's the anesthesiologist that really is most at risk when they're intubating the patient. So we need to be really careful when we talk about covering our faces, and there's a whole lot of conversation about that, which I will include links in my Renegade Roundup, but I will not take time to cover here in our forum. At Bakersfield College, we're ahead of the curve, and as Chris Tyner mentioned in his presentation, we're letting the times guide our creativity. Moving to the next slide. I'm not going to go over our timeline. It is going to be posted on the website, but it gives you a sense of us being ahead of the curve. I have 2 slides for you, which we will click through to the next slide, which shows us that what are we doing? Our nursing students are out there at the hospitals right now. 69 students with Kern Medical Center, with the Bakersfield Heart Hospital, and with Dignity Health. They're getting their externship credits done by working at the front lines. I've quoted a student here, Rubio, Chantel Rubio, and this was in NPR, and you will be hearing from her next week. So that's what our students are doing, and I'd like to do a shout out to all of the healthcare professionals who are really out there helping our community. Next slide. Politico just came out today at 8:30 with this news item that it also hit the Washington Post and many of the other news channels, that we have 10 million workers that have filed for unemployment. So what happens when unemployment hits serious numbers? People go back to community colleges. So we're facing the combination of a recession as well as having to serve more students. It means less money coming to the colleges, sure, but we still have to serve more students. BC responded again ahead of the curve with our Back to College program, with classes starting on April 13th to May 15th. But I know Enrollment Services, Jackie Lau's department, has been working with counseling and with outreach and with financial aid to enroll students, because these students, these individuals who have been unemployed, can come back and retool and get a college degree, but they can also get financial aid. So I thank everyone who made this happen. Moving to the next slide. This is another article that I'm tracking, and I just wanted to introduce this to you so that you can think about how I'm thinking about the fall semester. At BC, summer is mostly going to be online. I know that Billy Joe and the deans and the department chairs might bring back a few laboratory courses, and we'll have to go through stringent protocol in cleansing the labs and even be looking at different types of face covers to bring students back into these environments in the summer. But you can see already that I'm thinking about the fall semester. And if you read Ed Young's piece in The Atlantic, you will see the significance of the next year and the aftermath of COVID-19. So I invite you to join me and to think about what the future is going to hold for BC. And I know that the times will guide our creativity. Next Monday starts our spring break, and the team was really thinking of canceling all of our sessions for spring break, but many of you emailed me saying that you look forward to actually tuning in to the virtual forum. So we decided on a compromise. We will bring you our forum both on Monday the 6th and Tuesday the 7th, and then we're going to go dark, okay? And you'll be getting an external perspective. Assemblymember Vince Fong is going to tell you what's happening in Sacramento. Jean Fuller is going to be sharing her words of wisdom. Richard Chapman is going to be talking about the economic forecast. And Romeo Agbalog is going to be wearing his hat as, not as a KCCD trustee, that should actually read Dylan, that he's going to be wearing his hat as the executive director of Kern Citizens for Sustainable Government in sharing some of his perspective. But now I know you're all waiting to hear from our amazing panelists, Abel Guzman, Diane Allen, Jackie Lau, and Matt Jones. Let's start with our rural initiative. Abel.